There's a growing mountain of scientific evidence confirming that a good oral health routine plays a vital role in preventing disease and preserving your overall wellness. According to the American Dental Association, the need for oral care quickly rises after the age of 45, and we need to be more faithful to our checkups than when we were younger. So here to help us brush up on those dental demands is Michelle Strange.
Most people understand how important oral hygiene is, brushing and cleaning between your teeth, but it's equally important to schedule those routine dental checkups, and that's not just to prevent disease. Your dentist might discover signs or symptoms of what could become a more serious illness, because our mouths are like a looking glass into our health. I'm speaking with Dr. Jeb Jacobson today. How are you?
I am well. Thanks for the invitation, and please call me Dr. J.
Dr. J, you have made it your mission to convince people that they need these routine dental checkups. Why are you so passionate about it?
Well, I think one fact that isn't known by many is that dental checkup is really, as you mentioned before, a window into the body, and we are disease detectives. There are some 120 different systemic diseases where if a dental and dental hygienist does a thorough examination, can see the early oral manifestations of those diseases. So it's the early detection that's the key. Examples are cardiovascular disease, respiratory diseases. One that I want to bring the audience's attention to is oral cancer and its changing nature in America. Oral cancer is a killer. It probably kills as many people in the United States as does cervical cancer, skin cancer, and many people are not aware of it. In fact, it's the 6th most common cancer in men in the United States. It's deadly. Again, that survival rate is about a coin toss. Should you survive it, you become extremely disabled. So the point is it's changing, though. It used to be an old man's disease. Now it's a disease where women and young people are increasing in frequency.
Wow, that's really interesting, actually. And it just gives a good argument to identifying diseases earlier rather than later.
That's the cornerstone of the profession, is that preventive aspect. And the dental hygienist and the dentist working together, preventing tooth decay, gingivitis, which then can lead to periodontitis, which are all bacterial in origin. So getting in, cleaning, even though we do a wonderful job at home, making our mothers proud, we still leave many millions of bacteria behind. That prevention not only is preventing those 3 diseases, tooth decay, gingivitis, periodontitis, but as you mentioned earlier, you're not just preventing the oral diseases, it may be the associated medical.
With the rest of the body. And it's also important to know that depending on your needs, your frequency of routine oral exams can range anywhere from 3 months, 6 months, 9 months, maybe even a year, just depending on what you're needing. So who is not seeing their dentist for these routine checkups?
The evidence is overwhelming. Those that don't see a dentist on an annual basis don't have dental insurance. And that's the key, we think, in getting individuals to come to the dental office, is it helps mitigate and reduce the cost or the perceived high cost of dental care is dental insurance. And that's 126 million Americans, that's 40% of us here in the United States. We're doing a good job with kids, particularly through the Affordable Care Act, but it's the adults that we're getting very concerned about. We at Renaissance are particularly concerned about the elderly going forward.
And that's my favorite population actually to see. So who exactly are we talking about without dental coverage?
Yeah, what typically happens in the United States is you and I, as a benefit of employment, will have dental insurance and we will enjoy the benefits until we retire. Often when we retire, we lose that dental benefit. We sign up for Medicare, and Medicare does not have any dental benefits baked into it. Predominantly because in 1965, when Medicare was formed by the Congress, our predecessors didn't have teeth. There was no need for it. So when it comes to this getting to the dental office, early detection of diseases, prevention, if you buy dental insurance, a Medicare supplement, for example, there's an opportunity now to offer up a supplement. Renaissance offers a series of those where they can add that dental insurance component.
But dental care can be so expensive.
Particularly in the elderly. Yes. And you know this because your work with the elderly. Many of us will have restorations and fillings and crowns that have been long-standing that we've accumulated through life. Now we drop off and we retire and they need repair. There's a shelf life to those restorations, and typically those repairs are very costly, very expensive. That's where that dental insurance can help reduce those costs.
And when you speak of the elderly, another issue that we can see with seniors is that they're on a lot of medication, and they might even have some of the systemic diseases that's going to increase their risk for gum disease. And a lot of those medications are actually giving them some dry mouth.
Michelle, that's a great point. Some 400 medications we know have a decrease or a diminution of salivary flow as a side effect of that medication. Antihypertensives, antidepressants, decongestants, antihistamines. So, and that reduction of saliva puts an individual, an elderly, particularly at risk because the saliva has a lot of protective enzymes, components, elements that reduce the risk of dental decay, periodontal disease, et cetera. So without that, particularly those that are taking medications, really need a dental insurance to get them to come into the office for the cleanings, the dental hygienist, et cetera.
Thank you, Dr. J, for being here with us
Oh,
today.
Michelle, thank you.
Many patients who have not been to the dentist in years are oftentimes embarrassed to return even if they have dental insurance. I just would like to say we as dental professionals are excited to have you in our chair, even if it has been many years. So don't be afraid of judgment. We are happy you have taken the next step in improving your oral health. So make sure you follow up. Take care of that smile, and it will take care of you. Managing your dental care cost is a smart start. Learn more at renaissancedental.com. And take better charge of your overall health and wellness by visiting us at accesshealth.tv or follow us on Facebook and Twitter.